Let's continue our discussion on visual diagnosis, inspection. Still on body movements, let's now talk about twitching of muscles, opisthotonos, contraction of limbs. Twitching of the muscles. Twitching of the muscles consists of an involuntary quivering or vibration of the superficial muscles. In Western medicine, this is called fasciculation. Clinical significance. Twitching of the muscles may be due to yang deficiency, water overflowing, or qi and blood deficiency. In yang deficiency, twitching of the muscles is due to the defensive qi, which is yang in nature, not nourishing the superficial muscles. Chapter 3 of the simple question says, the refined part of the yang qi nourishes the mind, while the soft part nourishes the sinews. Water overflowing indicates a condition of severe yang deficiency, leading to the accumulation of fluids which may occur in the heart, the lungs, or the muscles. The accumulation of water in the muscles may cause them to twitch. General qi and blood deficiency may also cause twitching of the muscles when yang qi fails to nourish the superficial muscles and blood fails to nourish the muscles and sinews. So to summarize, twitching of the muscles can be caused by yang deficiency, manifesting with cold, tiredness, feeling of cold, tiredness, and a deep, slow pulse. It could also be due to water overflowing, manifesting with edema, coughing of profuse watery phlegm, and wet tongue. Or it could also be caused by qi and blood deficiency, with there is tiredness, dizziness, pale tongue, and a weak or choppy pulse. In spleen and kidney yang deficiency, there will be twitching of muscles, low backache, cold and weak knees, feeling cold, bright white complexion, impotence, decreased libido, tiredness, lassitude, abundant clear urination, urination at night, loose stools, poor appetite, slight abdominal distension, desire to lie down, early morning diarrhea, a pale and wet tongue, and a deep, weak pulse. In heart or lung yang deficiency with water overflowing, there will be twitching of muscles, palpitations, dizziness, nausea, vomiting of white, watery, or frothy fluid, a feeling of cold limbs, severe shortness of breath, feeling of fullness and stuffiness of the chest and epigastrium, thirst with no desire to drink, urinary retention, pale, swollen, and wet tongue, and a deep, wiry, or deep, fine, slippery pulse. In deficiency of qi and blood, there will be twitching of muscles, poor appetite, loose stools, weak voice, tiredness, blurred vision, dizziness, numbness or tingling of limbs, palpitations, dull pale complexion, pale tongue, and a weak or choppy pulse. Now let's talk about opisthotonos. Opisthotonos indicates a spasm in which the head and heel are bent backward and the body bent forward, as shown in this picture. Okay. Its clinical significance, opisthotonos is always due to liver wind, which develops at the blood level of a febrile disease. It may also occur after childbirth when the mother suffers from an infection, but this is rarely seen in modern Western countries. So this case is caused usually by liver wind, opisthotonos, tremors, severe dizziness, tinnitus, headaches, numbness of limbs, tics, stiff, deviated, or moving tongue, and a wiry pulse. Now let's go to contraction of the limbs. Contraction of the limbs consists in an involuntary clenching of the fists or contraction of the feet accompanied by rigidity of the affected limbs and the inability of the patient to stretch them. Contraction may affect any joints such as fingers, wrists, elbow, ankle, and knees. Dupuytren's contracture, often involving the ring finger or the little finger, is an example of this condition. In acute cases with sudden onset, contraction of the forelimbs may be caused by invasion of wind. This is always of short duration and self-resolving. In full conditions, the contractions may be caused by dampness obstructing the muscles or by heat injuring the body fluids of the limb channels. In empty conditions, the most common cause of contraction of the forelimbs is liver blood or liver yin deficiency. In the elderly, a common example usually deriving from liver blood or liver yin deficiency is Dupuytren's contraction, which usually involves either the ring finger or the little finger. Clinical significance. Contraction of the limbs may occur in various diseases such as arthritis, convulsions, or wind stroke. The patterns causing it are usually general deficiency of qi and blood, internal wind, cold, dampness, phlegm, or blood stasis. In most cases, the liver and kidney organs are particularly involved because they nourish sinews and bones. A general deficiency of qi and blood may cause a contraction of a particular joint due to blood not nourishing the sinews. For example, a deficiency of blood may affect the channels of the elbow and cause a contraction of that joint. Internal wind may cause contraction of any joint, and this is frequently seen after an attack of wind stroke. Cold, by its very nature, has a tendency to contract and may therefore cause a contraction of any joint, frequently seen in painful obstruction syndrome. This often affects the elbow or knee and is accompanied by pain. Dampness may cause contraction of a joint by obstructing the sinews and muscles. This is also seen in painful obstruction syndrome, and it affects particularly the wrist or fingers, causing not only contraction but also swelling. Phlegm may also cause contraction of a joint by obstructing the sinews, muscles, and bones. This is seen in the late stages of painful obstruction syndrome from cold or dampness complicated by phlegm, and it manifests not only with a contraction of the joint, but also with bone deformities. Blood stasis causes contraction and rigidity of joints because the blood fails to nourish the sinews and bones and stagnates in the joints. This is seen also in the late stages of painful obstruction syndrome from dampness or cold complicated by blood stasis, which causes intense pain and rigidity. In liver blood deficiency, this will manifest with contractions and numbness of the limbs, weak muscles, tingling of limbs, dizziness, blurred vision, floaters, scanty menstruation, dull pale complexion, pale tongue, choppy or fine pulse. Liver and kidney deficiency will manifest with contractions of the lower limbs, thinned limbs, weak knees, dizziness, tinnitus, hardness of hearing, lower backache, dull occipital or vertical headache, insomnia, numbness or tingling of the limbs, dry eyes, blurred vision, dry throat in the evening, dry hair and skin, brittle nails, night sweating, dry stools, scanty menstruation or amenorrhea, normal colored tongue without coating, and a floating empty pulse. In cold dampness, this will manifest with contraction and swelling of the limbs, cold limbs ache in the joints, a feeling of heaviness of the limbs, feeling of cold, white sticky tongue coating, and a slippery, slow pulse. If there is phlegm, this will manifest with contraction of the limbs, feeling of heaviness of the limbs, numbness or tingling of the limbs, feeling of oppression of the chest, sputum in the throat, a swollen tongue, and a slippery pulse. In invasion of wind cold, this will manifest with contraction of upper limbs, aversion to cold, fever, cough, itchy throat, slight breathlessness, stuffed or runny nose with clear watery discharge, sneezing, occipital headache, body aches, thin white coating, and a floating tight pulse. So to summarize, contraction of the limbs may be due to qi and blood deficiency, which will have the symptoms of mud contraction, tiredness, pale tongue, weak, or choppy pulse. It could be also due to liver wind with manifestations as pronounced contraction, vertigo, and wiry pulse. It could also be due to cold, where there is pronounced contraction and pain, feeling cold, ameliorated by heat. It could also be due to dampness, where there is contraction of joints with swelling and a feeling of heaviness. It could also be due to phlegm, where there is contraction of joints with swelling and bone deformities. And finally, it could be also due to blood stasis, where contraction and rigidity of joints with severe pain and purple tongue. Thank you for your attention.